Hello, I'm Ruth Umo, Leadership Editor at Fortune. The importance of mental health has never been more salient as companies realize that a healthy employee population has a direct bottom line impact. Here to discuss the advantage of investing in workplace mental health is Eva Borden, President of Behavioral Health at Evernorth Health Services, a division of the Cigna Group. Welcome, Eva. Thank you so much for joining us.
My pleasure. Thank you for having me, Ruth.
Absolutely. Well, as you know, the workplace can certainly support employee mental health, but it can also contribute to worsening mental health. What are some of the factors that are affecting employees' mental well-being today?
Well, it's such an important topic that we're discussing and something that's really come into light even more recently. It's undeniable that post pandemic, we're seeing a much greater conversation around mental health, just generally, and as well as in the workplace. But when I think about the factors that are really exacerbating mental health in the workplace, there are a number of things. It can be the pressure around how people are showing up and how do I think about the changes in technology. Return to work, an incredibly important focus right now that, depending on where people are trying to really grapple through. Just a handful of years ago, I was adjusting to how do I work from home and what my life looked like. And now I'm trying to figure out what does this new world look like? And change is exhausting. And so when we think about the factors that go into this, there could be understaffing, it could be changes in the workplace, it could be how do we go back to work that are really exacerbating or bringing forward this conversation around mental health. And so when I think about mental health, one of the biggest challenges is of all the people who have mental health needs, less than half of them are actually getting treatment. So we have two parts that are happening. One, we're elevating the conversation, but we're not necessarily elevating the treatment or what is it that people need to do. And so when I think about it, you're seeing all kinds of stress, burnout, as well as exacerbation of mental health conditions.
Yeah. One of those workplace stressors is employee burnout. It's a pretty nebulous term and one that can be challenging to identify in the workplace. How then can leaders gauge and address invisible issues like stress, like anxiety, like burnout before they negatively affect not only the individuals, but the business in its entirety?
I love the fact that you use the word invisible because the reality is it's something we don't see. When it comes to mental health, it's not evident. So if I break my leg, it's really clear that something has gone wrong. And I can say, I need time away. I'm not in the best condition. Or how can I make sure I've got the right accommodation so I'm showing up the best way that I need to at work? When it comes to mental health, it's not as clear. People can't see it. People don't know what's going on in someone's home life or what's actually happening. And so when we think about what does burnout mean, let's look at the full spectrum of mental health. So if you had 100 people sitting in a room, 25 of them had on average a true diagnosable mental health condition. But the remaining 75 have opportunities to manage stress, manage burnout, manage things along those levels. Just like we think about you can eat healthier, you can exercise more when it comes to the physical world. And so when we think about employers really recognizing that burnout, recognizing the quiet quitting, recognizing the lack of connectedness, recognizing the fact that people may not be showing up as their best selves, that's actually really important and can kind of make something that feels unclear more clear. But I think one of the parts that I find most interesting about the mental health space is where it may be hard to see it. However, it's not hard to quantify the value. So, one of the things that we did was last year really look and say if someone gets the proper type of mental health care, and so we're talking therapy, a relatively light investment, there's actually a very tangible financial return that can come in a short period of time. So, when someone has a diagnosable mental health need and gets the right types of treatment, we see that they can get up to $2,500 in savings in 15 months. And I'm talking about real savings that are in a short time frame. So when I think about how important it is to recognize the things that feel invisible, because they actually have very visible, tangible impacts on the bottom line. And that's why we think mental health is just incredibly important for business.
Yeah, absolutely. Well, let's explore what this looks like in practice. How does Cigna Healthcare address mental health issues with its clients and partners and subsequently lead to healthier employees who are less stressed out and who are less burned out?
So I think there's really three things that I would say are important to focus on when it comes to mental health. The very first one is, how do we help identify people who have a mental health need? We said earlier, it's invisible. Not only that, but from the average onset of symptoms to treatment, there's an 11-year delay. However, there's a tremendous amount of data, indicators, signals that can let you know that someone might have a mental health need. And so, one of the things we really focus on is how do we identify people early such that we can help them get to care and really shorten that window of time from symptom onset to treatment so we can realize those savings we talked about earlier. Number two is, how do we think about taking care of the entire human? So that means it's not just treating the behavioral health in a silo, it's how do we actually connect it across the medical and pharmacy space. When someone is seeking care, they often show up in a doctor's office for drugs, but we need to marry that with the right level of treatment for those individuals so that we optimize the outcomes. That joining up of a fragmented system is incredibly important. And three, we're all humans. And as humans, we're connected individuals. And so, how do we make sure we're actually supporting not just the individual who's suffering, but the family unit around him or her? That we're understanding and really making sure we're addressing the children's needs in addition to the parents and helping them get the right type of care by matching them with the providers that make the most sense. So when I think about it, those three factors are incredibly important for how do we advance and really realize that bottom line value.
Yeah, and it's worth underscoring that term holistic, and organizations will have to lead the charge in addressing employee mental well-being in a really concrete and comprehensive way. And again, the financial savings that you cited, even just in the short term, are pretty telling. Thank you so much, Eva, for your time. And now back to the Washington Post.